Well, the Convert trial was about testing the best way of giving chemoradiation in limited stage small cell lung cancer. Chemoradiation is the best treatment modality that we have for delivering a curative option to our patients with limited stage small cell lung cancer. Standard of care now for over 20 years has been the 45 gray twice daily regime since the Chirizi study, and that was shown in that study to be better than the 45 gray delivered once daily over 5 weeks. But in that time period, there's now been lots of developments with radiotherapy technology and our diagnostic pathways. And some people have been concerned that maybe the comparator arm was not appropriate in the Treasy study, um, in that the dose might have been a bit less intense. Yes, it was still 45 gray, but it was delivered over 5 weeks rather than 3 weeks. So to address all these issues, a large international randomized control trial was set up, the Convert trial, and that compared the standard of care, 45 gray in twice daily fractions, with 66 gray as a once daily regime. Statistically, the trial had a superiority design. So really the trial was seeking to answer the question, is once daily radiotherapy superior to twice daily radiotherapy in concurrent chemoradiation for limited stage small cell lung cancer? Well, Convert was a phase three open label randomized control trial. 75 centers around the world recruited over 500 patients. Eligibility criteria were fairly broad, including there was no upper age limit and PS2 patients were permitted. And the patients were randomized 1-to-1 to the 45 gray twice daily regime or 66 gray once daily. Radiotherapy could be 3D conformal or IMRT, and there was no elective nodal irradiation. Radiotherapy started with on day 22 of cycle one cisplatin etoposide, and PCI was offered to patients after their thoracic radiotherapy, provided there was no progressive disease at that stage. Well, the study did not meet its primary endpoint of demonstrating superior overall survival for twice daily chemoradiation. The median survival was 25 months for the once daily treatment regime, compared with 30 months in the twice daily regime. The, these differences in survival outcomes were not statistically different, but we have to factor in that the primary endpoint was to show survival superiority for the once daily regime. Toxicity was also worse in the once daily arm in terms of grade 3 esophagitis and grade 1-2 myelitis as well in the late follow-up data, although the numbers of patients were very small that were affected by those toxicities. So the headline from this late outcome data from Convert is that 45 gray twice daily remains the standard of care regime for concurrent chemoradiation in limited stage small cell lung cancer. Some centers where twice daily radiotherapy is not possible, maybe for logistical reasons, or perhaps it doesn't suit the patient for some reason. I guess oncologists in those scenarios can take reassurance that the overall survival outcomes were similar between the arms. But the overall headline here is that this late outcome data from Convert reaffirms the primary results and our current standard of care being 45 gray in twice daily fractions. Well, the paper has been published online today, and in the first instance, we look forward to discussing that with our colleagues in greater detail. In terms of the future of chemoradiation in limited stage small cell lung cancer, we expect two developments to be around the corner potentially. first dose escalation of the twice daily arm. There's some nice phase 2 Nordic data on that. And there's also some other phase 2 data from China looking at hypofractionation. And then secondly, I think novel radiotherapy drug combinations are probably not far away as well. We know that there is a phase 3 randomized control trial, the Adriatic study, currently ongoing, and that's testing if durvalumab plus or minus tremelimumab can improve outcomes after concurrent chemoradiation, giving these treatments as an adjuvant. And the primary endpoint in that study is overall survival, I believe. And both arms of the convert trial, both of those radiation regimes are eligible to take part in that study in Adriatic. And then other studies, LU005 is also looking at giving atezolizumab, another immunotherapy drug, both concurrently and adjuvantly with chemoradiation as well in limited stage disease. So I think in total the future is very bright for chemoradiation studies, and we certainly look forward to taking part in those studies in the near hand future.